Good morning. Oh, actually, I should say good afternoon. Thursday, the 24th of October. And today in North Walsham, being a Thursday, is the old market day. And you can see they're still doing the old asbestos something. Not quite sure how it works really. Hiya. Can I just ask how this is working? So you've got asbestos in the building.
Yep.
So what are you sucking out, or is there people in there chiseling it away? And
there's people in there bagging it.
Oh, okay, but you just keep them fresh air.
Yeah.
Going inside.
Yeah, there's a unit round the side.
Yeah, I saw that.
Big box.
Yeah.
That's sucking out the asbestos.
Okay.
Don't worry about it. That's got
I'm not worried.
four HEPA filters in there.
Okay.
So there's pure clean air coming out.
So is it in Kelly's fish shop, or is it in the?
Yeah, downstairs. Ceiling downstairs.
In the ceiling.
Yeah.
Wow.
So.
And is this being paid for by the council or by the owner?
We're working for the builders. There's a building contractor going in. I think they're refurbing the fish shop and put flats up above.
Okay.
So, yeah.
Because I've never seen anything like this, and it's like, oh wow, that's.
Yeah, we'll be working for the builder.
How long is it going to be to take? How long?
Should be finished tomorrow.
Oh, okay. Cool.
So.
Well, thank you very much.
Yeah, no worries.
Well, who'd have known that? Okay, let's have a little look down there. Afternoon. Oh, what, you're now finishing?
She's sold out. I wish I'd sold out.
Which one are you? What are you? Oh, you're on that one. I tell you what, you know these tin
Signs.
Yeah. Is there any chance that you can get ones with chickens on?
I do have one with chickens on.
Yeah. You mean you have one on you right now with chickens on? Oh, butt nuggets. You don't take card, do you?
Yeah.
Do you? I am going to buy that right now. Because.
Sophie, she asked for one with chickens. I've got one.
Absolute. Oh, that is fantastic. I have been looking for. Because the lady up there, she does them as well, doesn't she? And it's like I just can't find one.
You got chickens?
I do have chickens.
Okay.
I'm afraid so. I have a lot of things with chickens on.
Should come up on my thumb, 450. Yeah, there
Yeah,
it is. Just
yeah. Fantastic.
Do you want a bag at all?
Nah, you're right. I'll put it in my photography bag. Just move this over. It's a good thing about gimbal. I ain't got to worry about it being rocky. Oh, fantastic. Thank you.
That's all right.
Cheers. Bye-bye. Butt nuggets. I've got air-ons. Nice. Right, let's get going on the old gimbal. Nice. Oh, I'm so excited. I've got a tin, and you know where I'm going to put that? I'm going to put that on my shed with my chickens, my chicken coop. Okay, not quite sure why that's there. That looks pretty. That's the lady I was talking about with her tits. I wonder if her doggy's there today. Yeah, there's the doggy.
Hello.
Are you alright?
Yeah, you?
I'm alright. What's that sign down there for? That is that just? I mean, obviously, it stops vehicles from coming up. Is that a new thing?
Yeah. Stop delivery drivers and things coming up. It's working.
Is it? Well, that's good to know. You all right then?
Yeah.
Cool. See you later. Fresh veg. Pumpkins. Look at them pumpkins. Oh, let's go down with that. Great looking pumpkins, aren't they?
Lovely.
Don't kill my vibe. Now, I'm just going to pop down here. Because we're going to check out the community shop window. Because I didn't get that far the other day. There we go. Casually. Yeah, look. Happy Halloween. Right, we are going to go to the community centre. That's my plan today. There is the North Norfolk District Council Community Connectors, they are called. And from what I'm guessing with the poster, is there's probably going to be stalls there with valid information. And if the wind is blowing, I do apologise. Do you know what I should have done? Let's go across the zebra crossing like a good pedestrian should. And hopefully people will either slow down or stop. Yeah. There we go. Right, what I'm going to do is I'm just going to quickly stop and put my butt nugget tin in my bag. And while I'm doing that, I'm going to let you have a little look at Chester in his natural habitat. How's that? There you go. Actually, the sun. Let's just move the sun around a little bit. There you go, Chester. In your full glory. There you go. Alright, pop this in my bag. Just like that. Okay, come on Gimbal, don't let me down. On Saturday, 26th, there's going to be a big fundraiser at North Walsham Fire and Rescue Station. There you go, look, there's a poster. Also, there's donation boxes where you can donate stuff. So it doesn't always have to be a charity shop. But this one is for the firefighters charity. I did put the link up with the poster on the community page on YouTube. There you go, look. Car wash, you bring your cars down. Otherwise, just donate money. It's in support of all firefighters and ex-firefighters. Yeah. They still haven't done that yet. I know the insurance has gone through, so I'm guessing that's going to be built at some point. Right. I just walk around the corner here. I was probably a little bit early because some points. Yeah, come a little bit early just to see if they're setting up and whatnot. Looks like they're doing the bunting. There we go.
There we
go.
That is the extent of my knowledge. A blooper.
Living with help. Hiya.
We're from North Norfolk District Council. We're just running an event here today for
Yes,
people
I've come down for it.
yeah.
Yes.
bless
Oh,
you.
sorry, my gimbal's a bit. I've got a new gimbal, so I'm learning.
It takes a minute, doesn't it?
It does. Cool.
Hello.
Let's have a look. Are you still setting up in there then?
Yeah, it starts in about 15 minutes, I think.
In about 15. I'm just going to have a little wander around.
Yeah,
in case
yeah,
anybody doesn't want to be on camera publicly. Do you know what I mean? Public. Hiya.
Oh, sorry.
Oh wow. So they're starting to set up slowly but surely. Aces. Cataract treatment. Let's have a quick browse, shall we, while we've got time? Oh wow, look, this is the Alzheimer's table. I knew that as soon as I saw these. Great little things for people with Alzheimer's and dementia to fiddle. Just to fiddle with. Textures, buttons, there's probably things inside as well. Yeah. Vascular dementia. Okay. Looks like. Come on, gimbal. No, the way, gimbal. There we go. What's this one? Integrated care. Where's carers? Getting late in life. What's this one? Is that in integrated care as well? Have you got both tables, or is that?
No, I think this is Age UK.
Oh God, of course it is. Yeah, I've just seen it on the.
Yeah, just from I haven't seen anyone there yet, though.
They obviously came early.
I must have done a very long time.
Came early and gone for coffee. Oh, can I nick a lolly?
Of course you can.
Oh, thank you. My favourite ones. Oh, cameo calf. That's good to see.
Yeah, it is.
Hang on, let's just get my gimbal. I'm still learning with this machine. What we got over here? Breast cancer. Oh, more chocolate. Afternoon. I can say that now. No, you're right. You're right. I won't get you eaten. Don't worry.
Nobody needs to see that.
Nah. Oh, these are handy. They're good. Having magnets. Oh, no, very good. Just get this on. So what's the course back to normal? Sorry, I know you're eating.
No, but it's fine. So, when somebody's been diagnosed with primary breast cancer
Yeah.
and they've finished their hospital-based treatment, then this is an opportunity for them to come on a 2 half-day course that runs over 2 consecutive weeks to meet other people that are in the same situation. So we find that although their physical health might have improved post-treatment, their mental well-being might take a little bit of a dip.
So it's a bit of like a counselling and just...
Yeah, it's just peer support,
Yeah,
really. So we're
yeah.
there to facilitate the course, to give them the opportunity to reflect on how far they've come, things that might still be worrying them as well, that still play on their mind, such as side effects maybe from the medication,
Yeah.
fear of it coming back, fatigue, all of those things are quite common concerns really.
Yeah.
And then the second week, we have a breast care nurse actually there at the course to answer those questions that have come about
Okay.
in week 1. And then we finish it on sort of some positivity, 5 ways to well-being, kind of setting intentions and
Yeah.
looking forward. Because the feedback we hear is that when they finish their treatment, it's a case of, we'll see you in a year's time for your routine mammogram unless there's any problems.
Yeah.
And the feedback is that people feel a little bit like they're falling off the cliff.
Yeah.
Not specific, I don't mean that derogatory towards the healthcare teams, but also to all that support network, the wider support network that they had around them.
Yeah.
Everything starts to sort of go back to normal as it was, and they are not necessarily
Yeah.
back to normal themselves.
Especially with family members and
That's
friends.
right.
They
People
think,
might rally a lot, and then all of a
Yeah,
sudden,
and
if
then
you
it
start to
stops.
look better, and maybe, for example, your hair's growing back, or you're going back to work part-time, or whatever it might be,
yeah,
it's like, oh, you're okay now.
yeah.
But perhaps actually they might not be okay. So we have it up to 15 people, men and women, are both welcome to come if they've had
And say, so
breast
their
cancer.
partners, wives, husbands?
No, more if they've had the diagnosis themselves.
Okay.
But we do tend to find that the men don't come so much to it.
Do men have breast cancer?
Yes, yeah,
Do
anybody
they
with breast
really?
tissue. Yeah. Yeah,
I
much
never
less,
knew that.
I mean, much lower numbers.
Yeah.
Much lower numbers, but yes, anyone with breast tissue can get breast cancer. So we do have support for men as well, and they are actually welcome to anything that we do, but they may not necessarily access it. So, for example, the Moving Forward course, it does tend to be up to 15 women sat in a room, having a cup of tea, having a chat. That's not, I mean, as I said, the men are welcome, but it might not necessarily be their happy place and where they want to be.
Surrounded by women.
Correct. So we have other support options for them. So as we do for anybody, so we have a helpline, which is answered by breast care nurses. So anybody can call that. That can be friends, family as well. If somebody wants to speak to a breast care nurse, they can ring the helpline, and it's the nurses that answer the phone. And they can talk about anything. So that might be, again, it might be side effects, it might be concerns.
And this is the number, the helpline number.
It is, yeah.
Okay.
Yeah.
Okay,
and
that's
then
good to
obviously
know.
we've got campaigns for people to check their chest as well. So that's our touch look check materials that you can see there.
Do you know, I've seen them in public
doors and
toilets.
things. Yes,
Yeah, I
it's a
have.
great place because when else do you capture the audience?
Well,
really?
yeah,
And
we're just
people
sitting
do
there
tend
doing
to-
nothing.
Yeah, that's exactly it. And that's the time that you would do it. People
Yeah.
tend to check maybe when they're lying in bed, or maybe when they're stood in the shower.
Yeah.
So that's a great place to put them, and we've got them available in other languages as well, and a little bit more discreet than these leaflets. So those ones that you
Okay.
can see there that say "Know Your Breasts."
Do you find the cultures are a bit different to how
Yes.
they approach
Absolutely.
breasts, so to speak?
Absolutely. So some cultures may not necessarily want pictures of their breasts out on display or in a public place.
Yeah.
It may not be something that they talk about as openly as perhaps other people might do. So yeah, it's really just to engage in conversation. And we also use a language line as well. So if people do need to speak to us, then we can engage in a language line so that we
So
can
is that still the
translate it.
same number?
Yeah, the best way to
And
get
then
hold of
they-
us is always really through
that
that
number.
And then we've got other options. We have peer support, we have volunteers that people can be matched with as well if they want to talk to someone who's been through exactly the same situation as them. So everybody's situation might be unique. So it's not just, for example, I'm a 47-year-old woman and I've had this diagnosis and this is my treatment plan. It might also be that as a 47-year-old woman, I also have got teenage children that are struggling a little bit. Or,
Yeah.
for example, my relationship is breaking down, or my work not being supportive. So you can also speak to people that have got also experienced those things going on as well. So we've got loads, but we used to be lots of other charities that merged together. So there was also breast cancer care, breast cancer campaign, breakthrough breast cancer. Now, these
And
were all
it's now
before my
merged.
time, but we're all one now.
So how do you fall underneath the Community Connectors and the North Norfolk District Council then? Because that's what this is today, isn't it?
Well, I've just been invited as a guest to come along just to raise awareness, really, and for people to engage with us.
So this is across North Norfolk?
Everywhere.
Or Norfolk or UK?
Yeah.
Okay.
So things like this, so for example, the Moving Forward course that we talked about at the beginning, that's in specifically being held in Norwich. The reason for that is because we're working with the breast care nurses. It needs to be somewhere that's convenient for them to come to to help with the Q&A session and go back to work quite quickly. However, we do have something called an access fund, which is a pot of money available for people to be able to come. So for example, if you lived here in North Norfolk, for example, anywhere North Norfolk,
rural,
bit more rural, correct?
Absolutely, I can say it now. Rural,
exactly. And you might be like, well, it might not just be down to cost of getting there. It could also be the fact that, well, I physically can't get there because there are no buses or whatever it might be at this time. So you can apply to the Access Fund, which is a pot of money that Asda have given us when they sell our pink
Asda?
products. Yeah,
That's this one, is it?
it is. So they sell pink products for us at certain times a year. That money goes into a pot called the Access Fund, and that money is used specifically for people to come on the course.
Okay.
So they're not, not going to be interrogated or means tested.
Yeah.
Or, it is there. So
Just that they can organise a taxi to get you there.
Obviously,
or...
there needs to be a reason. Of course,
Yeah,
there
yeah,
does.
yeah.
But we understand that, as I said, somebody here, North Norfolk, might not be convenient for them to get on this course, but they might really want to and might really benefit from it, so
Yeah.
they can apply to the Access Fund. In addition to that, we do also run the course online several times a month at different times a day on different weeks, different days of the week. So also people can access a lot of our things online if they would like to.
I can imagine the young kind of doing that.
Yeah, it's
that is
a real
able
mixture,
to use.
actually. I think post-COVID, people have adapted quite well to doing things on Zoom.
Yeah.
And for some people, actually, maybe sitting in their living room, not leaving the house, might be where they feel comfortable. For other people, they might actually get more from it by coming and being in a room.
Yeah.
So we're trying just to make sure that it's accessible for all,
Yeah.
really.
Yeah.
And of course, if you are on the online course, there will be people on there from all over the UK. But of course, if you come, for example, to the Norwich course, you are going to connect with people that are more likely in your local area.
Make friends. And
That is exactly it. And we do find that they tend to stay in touch and form that kind of bond and form that peer group, which really is one of the whole points of the course. Yeah.
Yeah, absolutely.
And we have a monthly group in Norwich as well for anyone who's living with secondary breast cancer. So that's where the breast cancer spread to another part of the body.
Right.
It's incurable.
Yeah.
And we have a monthly support group in Norwich that they can come to, and that's run by a trained counsellor. So we have somebody there just to make sure that they're all okay and their well-being is looked after.
Cool.
Free to attend, and also people can apply to the Access Fund if they want to come to that every month.
Thank you very much.
Yeah.
I think it's sold.
Oh, yeah, I mean, that was a lot. I did all that off the cuff.
That was very. You can carry on eating now. Thank you so much for that. Thank you. Hi. I'll wait till you set up. Norfolk District Council. You're in the firing line, aren't you? No. Did you choose the wrong length straw? Only because I know how. Palace on the Hill is what I've heard it's called in Cromer. Have you heard of that?
Really?
Mm-hmm. Yeah. Is that where you're based in Cromer?
Yeah, in Cromer office.
Okay. Can you sell it then?
The Cromer office? Or...
Well, I don't know. What are you doing? Do you mind being on camera?
No, it's fine.
It's just from a YouTube. I'm just trying to find out North Walsham and keep them. But yeah, so what are you here for?
So I'm the energy officer at North Norfolk.
Yeah.
So I work closely with Norfolk Warm Homes. They deliver the home upgrade grant.
Okay.
So that helps residents get their home more energy efficient.
Yeah.
We've done a big project in Stalham at the moment where we've retrofitted around 100 homes, spent over £1 million installing air source heat pump, solar panel, insulation.
On 100 homes?
On around 100 homes. So we...
How much?
Around 100 homes.
No, how much did you just say?
Oh, over £1 million.
£1 million?
Yeah.
100 homes?
Yeah, so that includes all measures as air source heat pump, solar panels, and insulation. So they focused on Stalham because they come under the IMD 1 to 3. Next year, it's been released by government that the local grant for warm homes will be based in North Walsham. So
really?
It's IMD areas 1 to 2, and it'll be focused on North Walsham East and North Walsham Marketplace.
So that's where the office...
No. So it's what I work at the Cromer office, but under Norfolk Warm Homes, that's the areas we'll be looking at targeting next year.
Really?
From March. So, yeah.
So how do you go about doing that? Do people say... I mean, it's obviously people that are living in council houses.
No, it's private, it's privately owned or private rented we focus on. So it's a government grant that is for that demographic. If someone was living in social housing, then they'd have to contact their social landlord and ask for the Social Housing Decarbonisation Fund. So,
that's quite a lot, isn't it?
Yes.
That's quite a mouthful as well.
Yeah, or just SHDF. But their social housing landlord will know what they're going on about.
And it's North Walsham's turn to be...
Well, it's all over Norfolk. but because North Walsham is one of the areas that automatically qualifies, so we don't have to look at any bank statements. We don't have to. The only
It's
thing
not
we
means
would,
tested.
No, not at all. So the only thing we would need to look at is their proof of ownership or speak to their landlord if they're renting.
So, hypothetically,
Yep.
I own my house
Yep.
and I'd like solar panels.
Okay.
I can get that through this grant.
So it depends where you live. So say you lived in one of the IMD areas, I had to check with your postcode, and you had an EPC of D, E, F or G.
Oh my God. Right, okay.
So if you had an EPC of D, E, F or G, and you lived in one of these postcodes.
Oh, that's the
energy performance.
these things,
Yes,
isn't it? Let me just show that so we know what we're talking about.
Yep, so...
Right, so if you're in the category C and above, did you say?
No, D downwards.
D downwards.
Yeah.
Okay, so from the yellow band onwards.
Yeah.
And that would be your qualifier to have...
Yeah.
So what would... You see, I don't even know what solar panels are used for.
Property, we would be looking at... It's still in the talks at the moment with Norfolk Homes, but the main things that we're looking at is probably insulation for the properties, potentially solar panels, and potentially the heating source as well.
Right. So gas, electricity.
Yeah. So as I say, in Stalham, if someone was on a oil boiler, we were trying to get away from fossil fuels, so we would replace it either with high retention heat storage heaters or solar or air source heat pumps. Sorry. And then we would also install solar panels to help with the cost of the electricity, so that they could start generating their own electricity.
Yeah.
So yes, it was for all of Norfolk, but as North Walsham comes under the IMD area this time.
IMD.
Yes. They automatically qualify. But if you don't automatically qualify and you don't live in one of these IMD areas, then there's other routes to go down. So if you're on a means tested benefit, if you have a household income of £36,000 and below.
That's quite high, isn't it? 36,000.
Yeah, it's gone up. So it was 31.
It's now gone up to 36.
Up to 36, which is good. That's a good thing.
Okay. And is this free bulbs and stuff
free
as
bulbs.
well?
It's just, you could save up to £40 a year if you change all your energy bulbs to energy efficiency ones.
Yeah.
So.
And we have actually. We do. I remember when they first came out, they were really naff, weren't they? They were really dark, and then some used to. The longer you had it on, the brighter it used to get. Yeah. Right. Okay.
Yeah. So it's a really positive project, and we've heard so many stories of it being a real life-changing grant. You're focusing on people that wouldn't be able to normally pay for these sort of projects themselves.
Yeah.
In their property.
Yeah.
With the amount of work that they put in, it can go anywhere from around £20,000 to £30,000 per household. So
20 to 30,000 to get this all changed over.
So a lot of people wouldn't be able to afford that just by themselves.
So how much has been allocated then to be put aside for Norfolk? Let alone for even for North Norfolk. I mean, if you already spent £1 million.
Yeah. So that was with the last round of funding. We actually exceeded that amount of funding that came through. So as it stands, with the home upgrade grant, we don't have any more funding until March next year. So Norfolk Homes are just about to put in their bid for next year. So we'll know the amount that gets allocated to us in March or later this year.
So will it be the same amount of money, or are you?
We're anticipating it will be similar.
About £1 million again.
No, because it's all across Norfolk. So it's spread out between. There's 5 of us in the consortium. So it's South Norfolk and Broadland, North Norfolk, Kingston and West Norfolk. Norwich City have just come into the consortium as well, and Brecland as well.
Okay.
Yeah, so the only Norfolk local authority that's not in the consortium is Great Yarmouth Borough.
Why would that be?
They've gone with Eon instead.
Okay.
So they've just gone with a different.
Eon, isn't that a electric company, isn't that?
Yeah, so they just administer their home upgrade grant for them, and they deliver it on behalf of Great Yarmouth.
Okay.
I don't know. It's a bit of a mind.
It is, isn't it?
Yeah, because there is also another scheme called ECO, which is here, which is an obligation that's put onto energy suppliers from government. And we've done around over 100 homes now in Norfolk. It's a different scheme to the home upgrade grant. So how that works, there's Eco 4, so if you're on a means tested benefit, you automatically qualify and you can get your home upgraded.
Whether you own it or not.
Whether you own it or not, it's the only properties that they won't be able to touch is social housing, because they have the social housing decarbonisation fund, so they have to go to their housing provider.
But isn't that on new builds?
Nope.
Or does that include old builds?
All stock.
Okay.
Their housing provider has to apply for that. But I know like the bigger ones, like Flagship, they have been allocated funding from the Social Housing Decarb Fund.
Have they?
Yeah. Yeah. And I'm happy if someone calls me, I'm happy to run through that, get them contacts in their housing provider so they can speak to.
Say somebody had dampness in their place and it was under an association. Would you be able to support them in getting that sorted if that was through an association, or do they have to go through
It would have
association?
to be through their association to fix it. But if the housing association was refusing to fix it, then they could potentially come to our environmental health team, who could then get in contact with the housing association. But I would hope that it wouldn't get to that point.
Well, yeah, so would I. But little things that I hear, and it's like, how do you make that connection to be able to support someone a little bit further? Do you know what I mean?
But even if someone's in a rental property and they've got bad problems with damp and mould, then they can contact the environmental health team at North Norfolk, who will advise them on what their next steps can be.
Okay.
Because it's really important that gets sorted. Cause
Well, you just don't know what you're breathing in, do you?
No.
Yeah. Thank you.
Worries.
Thank you. I think I'll watch this back and be like, what are them letters again?
No, but if you have any questions, you can just give me a call.
Okay, cool. I'll put that on there. I hope you don't get any funny calls. But
no, that's fine.
Energy officer.
Yes.
Sorry, how do you pronounce your name?
Dulcie.
Dulcie.
Yeah.
Thank you very much,
No
Dulcie.
worries.
Thank you.
Hopefully someone will view it and be able to.
Well, you never know.
Retrofitted. So
you never know.
It's such a important thing to do to live in a warm home.
Well, we all want that, don't we? Do you know what I mean? I mean, you've only got to look. I mean, are you? Do you know North Walsham?
Yes, I do know. North
do you know?
Walsham.
You know when you walk through the expensive footpath in
Yes.
North Walsham? Have you ever looked up
into the flats?
And
the shops.
some of the windows panes are gone, and it's like, condensation, and it's like, we spend all the money down below, and it's like, who?
I mean, I guess that would be down to the
landlords,
the owner that owns the actual property, because it's the whole shop, isn't it? It's a shop, and then normally a flat on top of it. So it would be down to them to fix that. But
it would be nice.
Yeah.
It would be nice. But next time, you walk down, you look how many windows are popped out and not even there.
Yeah.
And
it's such a lovely town as well. So
and it's like let's start with that, and then I don't know. I just want it to look nice. Want it to look nice, don't
exactly.
we? But look up next time.
Yeah, I will.
Right, we've got
It's like busy
financial.
looking down.
On our phones 9 times out of 10, isn't it? So what's this? Financial inclusion. Hiya.
I work in the benefits department in Norfolk District Council.
You work what? Sorry.
The benefits department at Norfolk District Council. So
In Cromer. Okay. Palace on the Hill. That's what it gets called. Have you heard of that saying?
I've had lots of sayings over the years.
This is a clean one now.
I started there when I was 17 and I worked in front reception for a bit, and even the words that the people who work there used to call it were interesting. So
okay, that's
many
cool.
years ago now.
Bloody hell. Okay.
So we go out and we offer a visiting service, so we see people in their own homes to make sure that they are claiming all of the benefits they're entitled to.
Okay.
So there's a few different roles within what we do. Some of it is where we sort of do more proactive work, because we have quite a lot of data at the council, because we know people that are already on benefits and things like that.
Yeah.
So we do work to maximise those people's income. So if they're supposed to be on pension credit or they're supposed to be claiming something that they're not, we'll let them know and invite them to claim.
Yeah.
Equally, someone can contact us if they've got concerns about somebody, or referring to our help hub, and then we can pick up financial
What's your
assistance with that.
help? Is it a place, or is that just a...
So the help hub is something that's run once a week by the social prescribing team, where people, so like social workers, people outside, external people can refer people in if they've got like concerns about somebody, or if there's somebody that's got some needs.
Right, yeah.
And then we'll pick up the financial side. So if somebody needs to claim help with their council tax, anything like that really, then we can do those things. So sometimes it's a phone call, it's just telling somebody because they don't know, and sometimes it's going out and visiting someone and helping them face to face actually at home and going through that with them. We're really lucky at the moment. We've got a gentleman from CAB working with us as well for debt. So we work quite closely with them, which is excellent. So if when we talk to somebody, they then disclose that they've got issues with debts and stuff, we can get them some help with that as well. So it's a really great thing to be part of, and help people where we can.
Oh yes, please. So can anyone get in touch with you directly then?
Yeah, so you can. That's the telephone number for the main helpline, because obviously I'm out on district.
Yeah.
But there's a few of us within the team. So Danny and Holly typically man the phones. They'll be able to do things like food bank referrals, those kind of things as well.
Okay.
And then they can make an appointment for someone like myself or Julia to actually come out and do something if it's more complex. So something like an attendance allowance form or a PIP form, all those kind of things.
Okay. And that is just North Norfolk, not Norfolk. What's your area that you?
So basically, if that person pays council tax to North Norfolk District Council,
Yeah, I
then
was just
it's
thinking
our
of your
area.
right.
Yeah, so we kind of go out as far as like Wells, just on the border to Holcombe, and then all the way along to like sort of Seapawling into Stalham, but we're not as far as Elsham. So we're quite a long wide, but we're not. Yeah, that's the thing. Like for us in North Norfolk, very very elderly population and very rural. Not that great of public transport. So that's why being able to offer the home visits is really important.
Yeah, absolutely. I'm just trying to think if there's any other questions of
That's all right.
what because I know was it last year? I think media released that there was a lot of money not being spent that people were entitled to.
Yeah.
Is that still the case? Is there
so
still
with things like pension credit, that's incredibly underclaimed, and at the moment, because of the changes to the winter fuel payment, there's a massive push on making sure that we get people to claim that. For people that are elderly, the barriers to claiming might be physical barriers. So it might be that they don't have access to a telephone to make the phone call, they don't have access to the internet to apply, or they don't know how.
Yeah.
Especially like rurally around here, we still have people that aren't on the internet.
Yeah.
Can't access it. The telephone lines are poor. Internet.
Well, especially
terrible.
if we're cross, because I mean we're losing our copper line, aren't we, next year across the board? And it's being here. If there is a power cut, I didn't realise, but that actually affects our phone lines as well, and it could potentially affect our mobile phones because of the masts of running electricity. And it's like, this is crazy.
Changing, aren't they?
Yeah, but is it for the good, or is it? I don't know. I would like to keep. I would like to keep our copper lines there.
The problem is they're so old and they're so hit and miss, and so many don't work. It's that factor, isn't it? It's so difficult to know what the right.
I
don't know enough about it, but for us,
well, you should, because it impacts us all, especially rurally. Because how do you phone for an ambulance? How if we might have a candle, but that's all you're going to have.
Yeah, no, absolutely.
But,
so your question about underclaimed benefits. So yes, pension credit is a big one. So what we've been doing as an authority is we've been using our data, so our data that we have, where we know people already may be claiming help with council tax support.
Yeah.
So we would then know by running reports on our system that they were eligible for pension credit. So we're then mail shotting those people, contacting them and saying, do you know you're entitled to this money? This is how you do it, and inviting them to make a claim.
That makes life so much easier, doesn't it?
And then what we can then do is for those people who still can't or don't know how, if obviously this was to talk to someone like myself, because our details are on that letter, we're then able to either physically help them do it, if that's what they need, or put their mind at rest by answering questions that they may have around that. So it might only be that you're getting someone 50 pence a week pension credit, but it's not that's important. It's if you're on that, you then get the fuel allowance. If you're over 75, you might get a free television licence. A lot of the utility companies, so BT, for instance, they'll do an essential users package.
See,
it's loads of other things, so it's not just
that.
I'm going to get 50p a week. It's not worth doing. Well, no, you're going to get 50p a week, and then you're going to get
access to all these other.
Yeah, so for us, it might be that people in the past, because it is just for some people it might only be a small amount. Might be they thought, it's not worth it.
Yeah.
Whereas now, with the winter fuel payment changes, it is worth it.
It's just a shame they can't do that anyway. You've got the one phone call, haven't you? Like at the end of the life, you've got the one phone call where you make that one phone call and everything stops. And it's like, why can't we have that one phone call where everything starts? So when you hit that trouble of whatever rhyme or reason, that can just happen rather than having to sort it out yourself, especially when you really need it. Do you know what I mean?
And that's
mental health
really
wise,
it's having our team, because for those people, all right, they have to ask for
they have to find you, they have to find the numbers, and it's always that role, especially if you've got did you say cab with you as well? I mean, is it cab? The
citizens advice.
That's the one. That's great. You've got that connected to it, because cab is very difficult to get hold of people now, because you have to book appointments, don't you, which can be months down the line. And in between time, if you've got bills to pay, you can lose your home with it as well. Do you know what I mean?
Absolutely, and that's where hopefully our service, because we can tap into those people before that happens. We can help someone by getting them on the correct benefit, help them stay independent, help keep them in their own home. A lot of elderly people we go out and see, if we can get them things like attendance allowance, they can then use that money to, use taxis, have cleaners come in, do little bits and pieces to keep them at home, keep them safe. Then that means they're not costing money in other areas because they haven't had that support. So it's that preventative kind of work that we're hoping to be able to do.
I mean, this has probably got nothing to do with you, but I'm starting to read that they're going to be changing the disability where it comes to, I imagine, ESA and all the rest of where your disability is. So there's like different
migration onto universal credit or the qualifying criteria.
Well, I think there's a lot of fear-mongering going on about it at the moment, but what I'm seeming to get is to change the criteria of a disabled person. So, if you can walk 20 yards and stuff like that.
And that did start with the Conservatives. So I know that they started in the run-up to the election talking about PIP and what that looked like. But we only have to look back just over 10 years ago, and it used to be disability living allowance.
Yes.
They brought PIP in to replace disability living allowance
for
the
working
age. Well, no, it was to make about 20% of the people that qualified for it before not qualify anymore. So that was like the whole agenda behind it. And that, so as people migrated from disability living allowance to PIP, then
they lost.
Many people then no longer qualified. So whether they'll review the PIP system, the point system within PIP, or whether they'll change it, I know, like I said, before the election there's a lot of talk, and nothing's been said since Labour's been in, but obviously we're waiting the budget and we'll have to see what's said and what the plans are. With all of that, everyone else knows just as soon as we do. There's nothing, it's not like we know beforehand. We all know, as when it gets announced, and then obviously we work with what's available. It's just not nice for people when they're worried about what might change and how things get affected. But it's no different to the winter fuel payment though. We didn't know that was going to happen beforehand. We knew at the same moment everyone else did. That's, we were just as surprised as everybody else.
Well, thank you.
That's okay, no problem.
I shall leave you in peace, and I hope you have a nice afternoon.
Thank you.
It's getting busy now. Thank you. Okay, what's this one? Finding. Come on, Gimbal. No, wrong way. No, wrong way. Right, Stroke Association. Here we go. Right. Stroke Association. I'm guessing there is a... Oh, there we go. There's a number. Communication problems. TIAs. Okay. I'm still learning with it. Have you seen what this is? A gimbal.
Oh, it's a gimbal.
Yeah, this is what a gimbal is, and it does reduce and it stabilises quite well as well.
Right,
so you don't kind of,
Yeah.
you know, that works like that, which is brilliant.
Yeah.
But hello, nice to meet you.
How are you?
I'm good, thank you. Are you? Is this?
Yeah, this is this.
This is you guys.
Yeah, this is it.
Are you struggling, disabled?
Working well Norfolk, basically. So obviously it's a pilot that's running at the moment until March. We're hoping it's going to get extended because obviously nobody realised that obviously there's going to be an election and everything stands still.
Oh yes. Oh yes. Hang on, let me just get my gimbal right because it's right. So what is it you
Well,
actually?
We work with Norfolk County Council.
Yeah.
And we're funded by the government. So
Okay.
for this pilot, and work on the working well side, it's obviously we're looking at getting people with lower ends of the scale mental health issues like anxiety and depression
Right.
back into work. So it could be like things like mums that haven't worked for 20 years and they're really anxious about having interviews and stuff like this. So we can do sort of like CVs, interviews, everything like dummy interviews.
Yeah.
Looking for jobs, what they'd like to do. But also, which is really important, for those that are employed, we can give those 4 months worth of support as well. You know, once they get into work, we can give them 4 months. But also for employers, we can offer 4 months of support for any of their people that may be struggling.
Okay.
With obviously mental health or physical health. So we do obviously physical health as well. So yeah, no.
So how hypothetically, how would I access that?
Right, the way to access it is obviously take one of these leaflets. That always helps. They've got a QR code,
Yep.
and it tells you everything on there and how you can join the service. So it's basically you don't have to have a diagnosed mental health condition.
Right.
So if you feel that you need some support to get back into work, then you can just ring up. There'll be a guy on the other end. Obviously, take some information of you, and then obviously that'll be passed through to wherever in Norfolk that you're situated. So like for me, for example, I work North Norfolk.
Right.
So it either comes to me or my oppo, and then obviously we'd arrange to meet up with you, do like an assessment, and then obviously if you fit the criteria, obviously we can sign you up. But a lot of that assessment sort of process is done with the chap that you'll talk to.
Right.
First
The other thing that we're trying to do is we're trying to be part of what the doctor could recommend for you. Mm-hmm. So if you're on the up and you're recovering from your mental or your physical difficulties, and you go back and have your 6 weeks later and they go, "You haven't feeling really good, right? Would you like any help getting back to work?" And that's what at the moment, what we're trying to do is engage NHS and primary care to say, if someone's on the up, or even if they're not on the up, if they feel like they need some more help, rather than just go to the job centre and just gather everyone up and go, "We can help you."
Stop there. Job centres. People can still go to job centres. They're not shut. They're not got security on the doors.
Every 14 days.
Okay.
But we're funded by the DWP, which obviously funds the job centre. So they were never doing a particularly good job of, let's say, upskilling people.
Yeah.
So what they do now is they say, "We've got money to do it, but we think that other agencies can do it better." So in our case, the county council can pick someone locally.
It's sounding very much like occupational health, but from a public point of view rather than in work point of view.
Yeah, and not mandatory. So so things like Restart, for example, when people have been out of work for a long time and claiming benefits, and they maybe don't have a condition that stops them from working full stop, they are being mandated to go on to restart. So they would then, if they didn't go, they would lose some of their benefit money. So we're not anything like that.
Right.
What we're doing is trying to holistically say, how can we help you? Is it just a CV and interview skills, or is it, we need to go and look at upskilling you for a bit, or do you want an apprenticeship? That's another feather that we have working on. So rather than just being really, not scaring people to try and look for work, and I've worked for different agencies where I've had a cohort of people that will come to me and say, and we'll help them do applications, won't we, and sit on a laptop with them and do that. And then they'll say to me, "Oh, the job centre will be really happy with me," and I'm like, "I want you to be happy with me.
Yeah.
Don't do it for somebody else."
Let's just get this gimbal down on that bit. Yeah.
Move that out of the way.
That's all right. Don't you worry about that.
But I think the good thing is like the amount of, should I say, conditions that we see for people coming through. Obviously a lot of younger people now have got autism, ADHD, so obviously we can help those. We can give them longer than 5 minutes. Like we do sort of like an hour, hour and a half sometimes, depending. We can attend an interview with them if they want that. So there's lots of different things. We can link in with the employer if that's what they want, and obviously this is on their say-so, to put things in place to help them. There's always this bone of contention, isn't there, of do you declare your mental health at an interview?
Yeah, and your physical health, because it comes down to liability, doesn't it, on a job?
That's
so,
right.
I mean,
so there's always that. So obviously we'd like to say to our people that is your choice. We're not going to talk to an employer without your say-so.
Yeah.
Without your consent. So yeah, it's an interesting job. It's worthwhile. I think the good thing is that we can give people with various mental health issues, a good bit of training and longer term help. Mm-hmm. So, and the very important bit is, like we say, we could work with someone for, say, 8 months and then get them into work. But the good thing is we can then stay with them for another 4 months as soon as they've signed up for work.
Okay.
And for a lot of younger people, that's really important because, let's face it, nowadays they don't teach things like money management and life skills and stuff like that. So all those sort of things are really important. So we can give, advice and,
direction.
And signposting to various other organisations as well.
And confidence, because I don't think a lot of people even hear, do you know what I mean, that you can do this and stuff,
it's... Work ones is another thing we do it obviously once we get someone a job and we support them as well, but also we're looking at people already in jobs that are struggling, so they might be on long-term sick notes,
which is this one.
Are you coming across that quite a lot then?
Well,
with people already in
at
jobs?
At the moment, the in-work support take up about 25% of our caseload, so 75% of our people are out of work, roughly.
Right.
25% are in work and saying, could we have some help? And that might be with adjusted working conditions. It might be that they need help asking their employer for perhaps more flexible working hours. Things that, since COVID, things have changed within workplaces, haven't they, with hybrid work and things like that. And lots of people, don't realise sometimes what is reasonable to ask for, or they don't know how to do it. So that's where we can come in and speak to employers and say, this person's doing well at work. One of the reasons why they're not getting in is because they've got to drop their kids at school at 9 and they're not getting there for 9:30, or whatever it may be.
Do you find the difference, though, between a big organisation that has got the money to be able to provide that to a self-employed business that perhaps can't do that? Do you see differences in that?
You'd be surprised how many small businesses are much, much more flexible.
Yeah.
And how some of the bigger providers, certainly in this area, are coming around to that idea. That flexible shift. I think
you're right. With a small employer, if they lose a member of staff, it's a big hit for them. Whereas a larger employer, they could sort of suck it up a bit.
Yeah.
So I think there's that angle. But I was just telling Jason earlier that I've just been speaking. We do what they call employer engagement as well. We like to do a little bit more out here. But that's actually going in and talking to employers and trying to get firms involved who are disability friendly.
Yeah.
And basically saying to them, come to us if you want staff. Come to us. We're not going to act as an agency as such, but we could do it a certain extent because we've trained up people that could really fit your angle, but then obviously we can still give them the support afterwards.
Yeah.
So rather than a company go and spend and shed loads of money on advertising, they could quite easily come to us and say, have you got anyone that could fit this role? And we could say, yeah. And in fact, that's what I'm doing with somebody at Stalham at the minute, with a 40-bed residential home over there, and the people in there are really behind this.
Yeah.
And they want to give that person a mentor when he starts work. So he should be starting any day soon, because we're just waiting for his DBS to come through. So it's a bit of a headache, as these things are sometimes.
Yeah.
But so that's coming through now. So yeah, and they've got all these things, and they're going to put him on flexi hours, for example. So rather than a structured, so just drop him in gently.
So it really is individual.
Yeah, everyone is tailored individually. So which is what's nice about the job. So you can come in, it's not just the same old every day. Everyone's different.
Yeah, I like that. And then you're going to know.
The old saying says, person-centred.
Person-centred. But that's stuck, though, isn't it?
Yeah.
But then, so the old word is care in the community.
Yeah, that's right. Yeah.
Well, all the best for March. Will you know in March?
Well, we should know we should know by the end of October. They will carry on.
That you'll carry on. And what do you think the likelihood is? Is it looking good?
99%.
Good.
Yeah, because if we're taking people on now, we really need to know now, because we're going to take people on.
Yeah.
At the moment, we're probably saying it's going to finish in March, but then we can say, it's going to finish in whenever, so we can take you on a lot longer.
Yeah. Good luck.
Thank you.
And all the best. Thank you. Right, gimbal it round this way. The North Walsham Good Neighbour scheme. Actually, before we go to that one, Diabetes UK.
Regular functions where people with diabetes or people caring for people with diabetes can come forward and meet and network, as it were. Right, yeah. Is there anything as far as you know in North Walsham itself? I don't believe so. And where do you know where the nearest place to North Walsham might be? Well, what is it in your question that you're looking for? Is it for... Well, I'm with the North Walsham Good Neighbour scheme. Right. Part of our role, as well as giving practical emotional support, is to signpost people towards where they can get help. Now, sorry.
No, I'm listening. Because I'm interested as well.
In this day and age, I'm going to say that I would direct you towards Diabetes UK website, which is a rather impersonal environment, but it is very, very, very informative. Right. So it has
See if we can find that.
Lots of facts. It has very active forums where people with diabetes can chat with other people with diabetes. It's not the same as coming together around a table with a cup of coffee, sadly, but it's a sign of the times. That's interesting.
Sorry, I'm just going to interrupt. Sorry, where is the online website that you just talked about? The address for it?
It would be www.
Sorry.
No, it's helpful. www.diabetes.
Yeah, I didn't know if that was... Oh, is it Helpline? Is it that one?
No, diabetes.org.uk.
Oh, it's that one. Okay, let's just go back to that.
Can you see it here?
Yeah, diabetes.org. And the telephone number is a helpline?
It would be, yes, the general point of contact.
Okay. Cool.
Which is that
Thank
one
you.
there, wasn't it?
Yeah, sorry.
0345, wasn't it? I mean, the other thing that may or may not be relevant is we're members of something called the North Walsham Community Network, which is a network of community organisations, as the name implies, and we
support each other. We put on events like a Big Bash that we've had here, which brings together local people into contact with all of the local groups. And so, and we've certain priorities or projects, and one of those is gaining volunteers for organisations. So, if it was of interest to you or the organisation, then it may be worth thinking about becoming part of that network and joining that network.
Absolutely. It's all down to manpower. Diabetes UK employ fewer and fewer people now. It's true, I'm sure, of so many charities. They just can't afford it. So they rely on people like me who volunteer. I was at the same event in Stalham a month ago. I did an evening meeting at Long Stratton last Thursday. I can only be spread so far. So we rely heavily on volunteers. And remember, we're not professional healthcare. I have diabetes, so I can speak from a position of
your own
personal
experience.
knowledge. But a lot of people want to talk about symptoms or problems, and that. So there's a very fine line between what I can say as someone who has it, but is not professionally or medically trained. So that's why our website is such a good first port of call, if you like, in terms of trying to get information. But equally, I point you back towards your general practice and wish you good luck in finding an appointment within 5 or 6 weeks. But anyway, let's not go down there.
Thank you. It's been really nice.
No, not at all. The ladies here in the yellow t-shirts, they've
right, North Walsham Good Neighbour
they
scheme.
set up a lot of these type of events around the area, and they're giving me.
So this service is run by volunteers as well. So much is becoming volunteers. What have we got here? Hang on, let's get this gimbal going in the right direction. So what we've got? Magnets again. Magnets are very good. I'm noticing more and more people using magnets to advertise stuff. Do you know what I mean? Because you throw it on your fridge or freezer and you never lose it.
They've been very popular over the years.
I can imagine. I got one from a vet's.
Did we also have some magnetic thermometers that came from somewhere?
We did get a number, yes. Yes, fridge thermometers.
Yeah, and they were quite good because people don't know whether the house is warm enough, do they?
Yeah.
Oh, yes, there were those ones.
There were those ones. So that they knew what temperature to put the house at.
Yeah, that was part of an initiative from the county council.
Did it once and never again sort of initiative. That's what you're talking about, isn't it?
Say, your tattoo on your neck's lovely.
Oh, thank you.
Oh,
Thank
isn't
you.
it lovely that?
Thank you very much.
It's like, is it apple blossom? Cherry blossom?
I like to think cherry blossom.
Did it hurt?
I always get asked that. I'm just hard. I'm just hard.
Yeah, it's really good.
No, it's one or two little spots. It goes up. Okay. Yeah, it goes all the way around. Thank you.
It's really good.
Thank you.
With that.
Well, it's just subtle. It's just pretty.
Yeah,
tattoos get the wrong vibe sometimes from people, don't they? And it's like.
And there's one thing as well. It won't get wrinkled up.
That is true. But when my hair go white, I'll have snow on the branches. That's what I always think.
What is it that you are filming for?
I have a YouTube channel and I live in North Walsham and I am basically over the last, from the election.
Yeah.
Carol Waldman kind of came out and was talking about, money, pots, MPs, Are you aware of any of that? Maybe
no,
not.
because I've got a television, so I don't know.
Oh no, I don't know. Are you online? Have you got social media like Instagram and Facebook and all that stuff?
No, I do Facebook, but only to keep in touch with my daughters. I don't look on Facebook and stuff.
Find Carol Vorderman.
Yeah.
And go back probably a few months, because it's all to do about money pots and where money's being spent and everything else. And I kind of believed in that, because it's like, everyone's got a responsibility, including MPs as well as district councils as well as town councils. So it's a case of, over the last few months, I'm trying to learn how it all associates with one another. So how does a town council work? How does the district council then oversee that? Where does the MPs then come in? And how are these pots of money controlled? How is the money being spent? And I'm finding that there's a lot of cuts and everything else. But at the same time, I want the best for North Walsham. So it's that happy medium of going around with this, when there's events like this, to show it off. And to show, because there's a lot of people, elderly, those in wheelchairs, inclusion, do you know what I mean, that can't physically get out and whatnot. And I'm also doing it for that reason as well, so people can watch and see, especially if they couldn't make it today, they might be able to do it on catch-up, on replay. So that's what I do, and I like to just press record, wander around, so then you can get the feel of what things are like, when you walk down the street. You can just kind of feel what it's like, rather than it being a narrative thing from my point of view. Do you know what I mean? So this afternoon, knowing that all this was happening, I thought, well, I'm going to come down and find out myself and bring my buddy with me as well.
Well, I'm going to have a walk around and see what's going on as well.
It's very informative, actually, and everyone has been really nice, asking or answering all my questions of...
I'm going to go and talk to the stroke lady.
The stroke. Go for it.
I can't find out what stroke lady is.
She is just over there.
That's right, yes.
Yeah, the lady in purple.
Yeah.
It seems to be picking up now, doesn't it? Mind you, I don't actually know. Oh, that's at the time, because it started at 1, didn't it?
Yes.
So, I'm going to ask you some questions about North Walsham Good Neighbourhood Scheme. So, it's a voluntary thing. Do people sign up?
We as an organisation are available to anyone in North Walsham who wishes for assistance with virtually anything that they wish to have done that can't be done for them by one of the statutory organisations. What we can't do is plumbing or electrical work, because we don't have any volunteers that are suitably qualified.
Right.
We can signpost people, however. If we can't find a volunteer to do the job that they are requesting, we will be able to signpost them. We have a list here of organisations that we can that's activities, and we have another list somewhere for signposting, which is on our coordinator's site.
Can I take one of these?
Yes, certainly.
Last updated.
That is for monthly activities, and then we have one for weekly activities as well.
I would love one of them as well.
That would help with people who maybe don't get out very much and would like to take part in some other activity rather than sitting at home and watching.
So it's not just about finding someone to put a shelf up. It's a lot more than that.
Not just that. We can offer advice and we can offer help, but the majority of our calls are for lifts or collecting shopping or DIY jobs, gardening jobs, sometimes dog walking.
Okay.
So it's virtually anything that you ask, we help. That is our motto.
So
we've been going for 9 years now.
9 years.
And we are totally volunteer run. We have no paid staff at all, and our income is coming only from grants and from money we can raise at tombolas.
Okay, so you have to do your own fundraising. So you don't get direct money towards things like this that you are doing from
If there is a
Norfolk
grant
County
available
Council?
for something which we need, we will perhaps go out and see if we can use a grant for that.
Yeah, because I mean, these advertisement and that costs money, doesn't it?
Yes. It came out of our initial budgets, and we of course top that up.
Yeah.
And we get grant from the town council.
From the town council, not from the district council, but from the town council.
Yes. Because we are specific to North Walsham.
Right.
And town council very kindly offer us a grant every year. We're waiting for our current one for this year. But when there are grants available from other organisations, or maybe it's Waitrose or Sainsbury's, one of the supermarkets is doing a specific collection for an organisation in town, we might apply for that, and we have been lucky on occasions.
That's very nice to know, actually. Hypothetically, it's not means tested or anything, is it? So if you got a phone call from like somebody, say like a single mother with kids, and she wanted a bit of DIY done, she might be on benefits, she might not be on benefits, you would be able to help her?
Absolutely. We have no restrictions at all in terms of who we help.
Right.
The only restriction might be is when we can do the job, because obviously when we get the request, we then have to go out to our volunteers and say, we've received this request to do this particular job.
Right.
Is there anyone out there who can do it? So we then wait till a volunteer comes back and says, yes, I can do that job. And then we give the volunteer the details, and they make their own arrangements with that neighbour.
But you don't pay for the equipment or, say, the paint or something needs, as long as they're providing...
They must provide either their own equipment, if they already have it. Sometimes they do. Sometimes somebody will tell us, can you help repair the fence? I've got a new fence panel, but I need somebody to help to put it in place. So in which case we will go around and give the labour, basically. If we do have to do a job where it requires, say, somebody to go out and fit a new bolt on a gate, then we will say to that neighbour, I think I can find a bolt for X amount of money. Are you prepared to pay that? And if they say yes, then they'll go out and buy it, come back and fit it, and the neighbour will pay for the bolt.
Okay. So, just one more question. We have like donation shops, charity shops in North Walsham. And we also have the community shop, don't we, and stuff like that. So, if there's like DIY stuff that could be donated, like bolts and stuff like that, that people that will normally just chuck away, can those sort of things be donated, or is that just not?
Doubt it, because those things are a bit specific to a certain job. So I wouldn't.
So it just depends on whether or not the volunteer has got a bracket or something at the time.
The volunteer has in their own squirreled away cupboard a bolt which will do the job.
Okay.
And they'll take that along and they will use it and say, here, I can have the bolt for free because I've come out of the back of my cupboard.
I've just seen there, look.
The only thing we charge for, of course, is mileage. If we're taking somebody to the hospital, for example.
And what is that like? What, the standard 45p a mile?
45p a mile.
Okay.
Cool. Which we will tell the neighbour in advance how much it's going to be, so that they will have that money available when the driver comes along.
Okay. Thank you very much.
You're very welcome.
Thank you. Hope you have a good afternoon.
And you.
Okay, what's this one? Patient support. Okay. Somebody's hiding behind there. What have we got here? Look.
Carbs are present in a lot of foods, particularly in bread, biscuits, lots of grains, rice, pasta. But these are all stuff with potatoes.
It's in the Forum by the looks of it in Norwich. Wow. So, asbestos. It's so funny, isn't it, that we've just come from Cully's Chippy where they're doing all that. And we got what we got on sale here. Well, not on sale, but donations. What's that? Forget me not. What's this one? Armed Forces. And I've got little bits. Wowzers. Clinical trials. Rosemary Elizabeth Wallace. Let's see what's down here. Parkinson's.
So the printing obviously is a little bit more ongoing. Everything else is one-off, is it? Okay, brilliant. That's amazing. Thank you. Did you want to take that as well?
It might just be that when you phone up, it's on your radar.
Yeah, absolutely. Yeah, that's great. Are you here on behalf of a newspaper?
No.
Just for your own...
I'm a YouTuber.
Oh,
so
yeah.
I have come along to... Do you have a stall? Have you got a...
Yeah, I'm over there on the ACES NHS
Go on then.
cataract.
I'll come and get you. Oh, hello. I've just turned it round the completely wrong way. Yeah, I thought I'd come along and record and interview little people. Not little people, but yeah, go on then.
So we are a provider of NHS cataract surgery. We are in the community, which means we are based within a GP surgery. So we've got a clinic at Fakenham, inside the Fakenham Medical Centre.
Yeah.
And we have another clinic in Thetford, and that's the same. It's inside a GP medical centre.
So there's nothing to do with the Cromer Eye
Hospital? No.
Nothing to, right,
No,
okay.
No. So although we are a private company, we only do NHS work. So all our surgeries are free to the public.
Okay, and referrals come from doctors?
Optician, they come from opticians, and we can see people within as 4 weeks, basically, from receipt and referral to them actually having the surgery tends to be 4 weeks.
And do they pay for that?
No, it's NHS.
It's NHS. So you're a private company, but they can access it through NHS
treatment.
Yes. Oh, right. We need dentists like that, don't we?
We do indeed. We do. Yep.
4 weeks.
4 weeks. Yep. So we receive the referral. We'll phone the customer and we'll get them in for what we call a pre-assessment. So then we'll go through a lot of health checks. We'll explain what's going to happen.
Yeah.
We'll give them the drops to take away that they need to put in before they return for the surgery.
Right.
And then within 2 weeks, we will then see them for the actual surgery.
Okay.
It's really quick. The surgery takes between 5 and 10 minutes.
Really? Mm-hmm. I'm surprised you're not over there with the old diabetes people. Because I've just seen
supposed to be on number 19, but for some reason
glaucoma. It's like,
hoping Vision Norfolk were going to be here, but they don't seem to be represented today.
Vision Norfolk.
Yeah.
So that rings a bell, and I can't think why.
Poor sight.
Are they the ones? Because in the car park of
office in Norwich.
Oh, they're not the ones that come out in their van, or am I thinking of another?
I don't know, maybe they do.
I say a van.
I've seen a very small office off of Magpie Road in Norwich.
Okay.
And I was hoping to see them here today to link up with them.
Oh wow!
But yeah, feel free to take any of our brochures.
I will. Do you have telephone numbers and websites that I can capture?
Yeah, it tells you all about here. So it tells you all the services that we offer, and then on the back it tells you where our clinic is, and it tells you how to get to it.
I will take that.
But the two in Norfolk, I say they're Fakenham and Thetford.
Fakenham and Thetford.
Yep, and it's all NHS. It's all free at the point of service.
You see, I never understand that saying. Free to the point of service. Because it's like...
You're not going to get a bill.
Yeah, not yet anyway.
No.
But...
yeah, no, it's really good, and it's amazing how much it can change someone's life.
Yes.
Being able to see again.
Oh, absolutely. Absolutely. Okay. Well, thank you.
Thank you.
Thank you.
Well.
Thank you.
Thank you, Madonna.
You never know. What's this one?
Emily did mention.
Chronic obstructive. Right. Let's find out.
So if you call that number, get which option it is, family.
You might have to pause this if you're reading it. I'm glossing over it very quickly.
We get 4 forms we can answer. But if you leave a message with like your name and number.
Pumping hearts. I like that. Pumping hearts. Breathing well.
Well, you can call and find out this information for him.
Oh, look, COPD. COPD, that's quite a...
No, he's put a good on one in. He's third on the list.
Breathing well. Let's grab these bits. I don't want to leave anything behind. Norfolk Community Law Service. Legal clinics, employment, family, general debt, discrimination, family, domestic abuse, immigration, mobile legal advisor, social welfare solicitor, Prince of Wales Road. Okay, there's not actually anything. Community Law Service. We're going to ask. What questions have we got? In the meanwhile, we'll come back to that one. Hello, good afternoon.
Hello.
How are you getting on?
Yeah, good, thank you.
Parkinson's. Change attitudes, find a cure, join us. So, I have no idea what question to ask you, I'm afraid. I'm coming out and oh, just hang on, doggy alert. I like doggies. Okay, what is it you are doing here today? I suppose is a good question to ask first, isn't it?
So my role within Parkinson's UK is a local advisor, so I cover Norfolk. So
the whole of Norfolk.
The whole of Norfolk.
That's quite a big patch.
It is a big patch.
Mm-hmm.
So anyone that comes through our helpline and wants more specific localised support, so may need help with filling in benefits or can't get hold of their consultant or new to the area and not sure how to navigate the health system, basically anything, care, adaptations, anything for someone who's got Parkinson's, their carer, family member, they will come through to me and then I'll make contact and work with them for as it might be one phone call, just need one piece of information. Other people I may work with for longer, so there's no time limit as to how long I can.
Do you have a telephone number I could capture?
So this is this is the support and this is the
details.
Number
there you go, we'll get that. It's always handy. Thank you very much, Lee. Is there, how can I put it? I don't want to say is Parkinson's on the rise. Sorry, I'm just fiddling with my gimbal.
Oh, okay.
But is it?
I've been recorded, is it?
Yes.
Oh, okay.
Yes. Sorry. Yeah. Yeah. Public place, public space. Yeah, I'm just trying to beef all this up really for the community. Do you find the medication with Parkinson's, has that improved since?
Yeah, and there's always improvement in medication trials, research, so it's ongoing. We fund a lot of the research into medication. We will collaborate with other organisations to look at research. So yes, it's ongoing.
Yeah. Well, that's really. Let's have a little. Is this open? So anyone, so that is the whole.
This is the newly diagnosed. So this is what we all.
You get handed out when you get that phone call, I suppose.
Well, some clinics have them. If not, we will send them out to anyone who's newly diagnosed.
Okay. Oh, hello. Hello. Oh, wow. Because I don't know how you feel about this, but the old marijuana stuff, there's been talk about how it can stop the shakes and all that stuff. Is that still being trialled?
Yeah, there is still trials around CBD. And our website is a wealth of information. It's all the up-to-date information on research and trials and where they're at. And we send out newsletters to our members. And
Yeah. Wow. Pension credit. Yeah, I was talking to the lady over in the finance bit.
Yes.
About pension credits and all that stuff, and it's like you kind of all pretty much all are overlapping.
Yeah, I think benefits is such a massive thing that I think anyone.
I thought you were going to say a massive mess. But yeah.
I think anyone that can, it's such a big piece of work that anyone that can help. Some people do face to face, others over the phone. So it just depends what.
Are you charity funded?
No. Oh, charity funded, yes. So it's all donated money.
So you don't get any grants from
any grants
from the government.
No,
nothing.
It's all donated money, raised money, and legacy money.
Really?
Yeah.
Wow. I didn't know that. I thought at least is this under not attached to the NHS or under the NHS whatsoever? But you can signpost and...
Absolutely, yeah. And we work really closely with the NHS, the Parkinson's nurses, the neuro nurses, consultants.
Right.
So, and we have funded Parkinson's nurses in areas where there is little or none. So we will work really closely with what's kind of missing in an area.
Do you find that more in rural areas or in city areas? Or
I think it just depends. I don't think there's a thing. That's not really my expertise area.
Okay.
We've got a development manager in each of the areas. So they work really closely with NHS colleagues with things like that. I don't think there's a common theme. It's just
Okay. Well, thank you.
No, not at all.
Hope you have a nice afternoon. I'm just going to have to go see doggies now, I'm afraid. Thank you. Hi. I just wanted to come and say hello to doggies.
Yeah, as long as you're not.
Hello. How are you? Oh, look at them. They're so fluffy. They are gorgeous.
Hello.
I recognise you.
Cameo.
Yes, Cameo Calf. How are you doing?
Yes, a few years ago, yes.
That has been a few years.
Yeah, well, that happened, didn't it? COVID and everything,
Oh, tell me about it.
And, this is great. We're doing this.
I'm going around with my camera and I am interviewing people and finding out a little bit more about what they do.
Oh, that's nice. That's lovely. Oh, how are you keeping?
I'm fine.
Yeah, you look ever so well.
Well, thank you very much.
Yeah, changed one bit. You look younger.
Oh, I like that. I'll buy your coffee for that one, I tell you. So what are you up to then? Are you still at Cameo Calf? Or are you doing?
No, ages ago and left that now. Okay. There's been a few changes,
Yeah.
And health-wise and everything, you know.
Well, that takes a toll on us all, doesn't it?
Mind and all that sort of stuff. Yeah. I've got this tinnitus at the moment. It's driving me mad. Oh, apparently it's no cure.
Is it not?
That's been investigated at the moment because it's a very unusually rare tinnitus. So I need that literally a hole in the head.
I suffer with migraines, and luckily I don't get tinnitus because I found out that tinnitus can sometimes come with migraines, and it's like I'm grateful. I mean, I get my eyes and everything, but I'm still grateful it doesn't affect me ears. So I feel for you for that.
My friend, she gets a migraine as well. She lives down south.
Yeah.
But she gets a really bad one.
Dreadful.
I'm so sorry for her. Oh, no.
Oh, they're gorgeous.
That's so sweet.
That's a toy for him.
Oh. Anyway, I'll catch you later.
It's been
Good to
lovely
see you.
seeing you.
And you. See you later. Thank you. Right, where do we get up to? Okay. Oh. Victoria Swimming. Oh, yeah.
And if I give you that as well, then you've got, this is a one-day pass,
Okay,
and
Gimbal.
yourself as well. You could go online and do it, but if not, just give us a call.
Sorry.
And then you could maybe come very long, very short notice. Very simple. No, that's all right, because we offer NHS discounts on concession. Yeah.
I'm going to jump right in there. Hello. NHS discount. And what's that about?
So with our membership rates, if people work for the NHS and they've got their NHS
Oh,
card,
okay.
they get a concession rate.
But not carers or anything. It's just
no,
NHS staff.
No, we do emergency services.
Yeah.
We do, if someone is an official carer and has they've got a carer's letter, they can get
Have you seen those new cards that the NHS have been doing about carers? I don't actually have it on me, but have you come across those yet?
No, I haven't.
There's these cards, and I can't even remember. But basically, they're meant to help, like, if you go to the hospital, get free car parking. So it's kind of not quite replacing the blue badge, but it's more something for the carers, because 9 times out of 10, the blue badge has to go with the person, and it's like, well, I've still got to pay to get out of the car park. Do you know what I mean? But
oh, that's interesting. No,
I'm going to have to. Are you work?
So I've got everyone active, Victory at North Walsham.
Right, okay.
We're the membership advisors, but sadly I do not have a name badge or a card. But yeah, so because we do the blue light discount card, but we can't give it to carers in care homes or teachers. So because we do the emergency services with it.
Right.
But we do offer if you've got the carer's letter, you can get a concession rate. So it's a bit complicated, but we'll talk people through it. We also have cared for membership, which is free of charge membership, which is usually people under 16 that they cared for. They can come in, and their carers can come in with them to swim. When they're in the gym, they're not allowed to work out. They would just be encouraging. Then they would want them to go on the concessionary rate of the cared, being the carer.
Yeah.
So what happens is our rate is $39.99 a month, which covers the swimming pool, aquatherapy, water aerobics, the fitness classes from Pilates, Zumba,
Basically everything,
and then the gym. So actually less than a tenner a month. If you get the concession, it's $31.99.
We have swim sessions
wow.
as well.
Okay.
Yeah, so as long as you attend twice a week, it's paid for it.
Yeah.
And then we try and
it's all right.
encourage people to exercise out of work as well. So you've got Les Mills apps, exercises on there, so there's no excuse. But we try and tell people to do what's good for them. So, you know, even just meeting a friend, walking outside, instead of meeting a friend, having a coffee and a cake. Do you know what I mean? We just try and encourage everyone. Yeah.
Well, cool.
And we've got a competition at the moment at the front. If you want to fill out your details, you can do.
What's the competition?
So you can win a month to come in.
Oh, really?
Yeah, so you could do that. Look.
Can people access that competition online?
No, that's just for everyone today.
Okay.
Yeah.
All right then. Okay. How are you feeling about, this is completely off topic.
Yeah, go
on. About next door being sold off, the old sports park.
Oh, is it?
been sold. It got put through from the district councils last week.
Was that with the 54 houses?
That's with the 54 houses.
Oh, right, you're representing.
Yeah.
Yeah, no, I'm
Which I didn't know. I didn't know where they were. I saw on Facebook and local sites people have been talking about it.
Yeah. Well, that's the thing, isn't it? I mean, they had signs up, the old yellow, you know, what they're called, planning permission signs, didn't they? When you see them, I always look at them because you just never know. So they had. I saw 4 of them, and they were all round the actual site. But when you go into the town or anything, there was nothing ever mentioned or talked about. And the town council has refused it 3 times, but the district council has put it through, which is a big shame. But yeah.
So that's why people are probably talking about it as well then, aren't they, for town council?
Well, it's the thing is the impact on that road, because it's I wouldn't say a one-way system, but that road is for the swimming pool, isn't it?
Yeah.
And the people that live there. And now all of a sudden it's like, well, if you can put 54 homes there, that means that road is going to be changed. There was talk, which is why the council said no to it, because the road that you come into on Station Road off of Norwich Road, you know, your corner of your green, that needed to be widened, and it's like, but that's all community land as well. And how do you, you know, what's the impact on that?
I know, and everyone's already queuing, aren't they, to get through the traffic lights.
I know, it's going to be hell. But you'll probably see me quite a lot because I'm going to be there with this.
Well, I was going to say, is it that do you work for anyone, or is it just a general interest?
General interest.
Right.
Yeah, I stopped working a couple of months ago to look after my mum, so I'm now her full-time carer. And the job that I did do.
You probably be classed as an official carer, I think.
Well, that's why I've got that card.
I think you might have gone onto a card there.
So and because it's YouTube and it's political, and because of, you know, my nursing background, it's just a case of I still want to keep in touch with what's going on, and I'll do it there. It's not paying out yet. I've got more videos than I have subscribers, mind you, but it's for people to watch and look back, and for me to watch and look back and think, right, what might be a little shit, really. You never know, do you? But you know, yeah.
Good.
I'm now going to go and question it.
Yeah, you do.
Yeah, Norfolk Community Service. Not quite sure what they are.
If you are interested, then just come in, the membership, and then we'll get you in, and then if I give you
I used to come along, because you know with the old belts, when you used to put the belt on.
Aquatherapy.
I used to do aquatherapy because of my back and my nerve damaged legs. And it just got to the point where I had to stop, 1, because of money, but 2, when you're in the water, my back was like, no, I can't do this. So it's like I have to kind of start and stop things, and start and stop, and have that gap in between, because otherwise I'm pushing.
If not, take this, and
I should take that.
Take class, because obviously I can take your details if you want to give you a call, but if you don't want to, that's absolutely fine.
I'll probably come in, to be honest with you.
Yeah, and then you've got the competition there to win the month, so you could try and do that. But that's a pass. But what I would say is call us before doing it online, because it's a little bit different. So it's better to call us. We'll make an appointment. You can come in and use it for the day.
Okay. Thank you very much.
You're very welcome.
Thank you. Bye-bye. Oh, I think I've been beaten to it. Oh, I see. Hello.
After you.
We can both ask questions.
Yes, I'll just sit.
Hiya.
I'm afraid I don't have anything, like any leaflets.
You've not even got any sweets. What's going on?
This was very last minute me coming here.
Oh, was it?
I was in Fakenham this morning, and then I was like, oh, I'm all, found out about this, and was like, what?
Oh,
banner.
Come out now.
A banner will travel.
Well, I think we're going to be asking the same questions, really, aren't we?
Yes.
Start with, who are you and what you're doing here?
So I'm Katie. I am a mobile legal advisor for Norfolk Community Law Service.
Okay.
So my job is, we've got a base in Norwich.
Yeah.
but we cover the whole of Norfolk. So my job is to get the word out there and meet people across Norfolk. There's two people in my role. There was only one. How she did
throughout the whole of Norfolk.
Yeah.
And now there's two of you.
Now there's two of us.
Okay.
So, we could do with more.
Yeah.
But two is an increase on
Is
one.
this a voluntary thing that you do, or is it government granted,
I'm
or
a paid role?
Right.
We get we are a charity,
Right.
but we were lucky enough to get quite a big grant from the National Lottery earlier this year.
Nice.
To help to secure another mobile advisor.
So is that for the year, or is that for until the money ran out?
It's 5 years funding.
Wow. Okay.
Yeah, which is quite amazing. And so we offer free. So what I do is I travel across the country meeting people who've got maybe an issue. They're like, I'm not sure if this is a legal thing or not. And if it is a legal thing and we can help, I'll then kind of pass it on to the right team.
Being solicitors, sort of thing.
Yeah, we've got sort of a like a rota of about 70 solicitors that offer free legal advice.
Wow, okay.
And we also have specialist teams that will help with family issues. So, like, a lot of what they deal with is separation and then like child arrangements.
I think that's quite the common one, really, isn't it?
Yeah, that is probably one of the biggest parts of our work. And if there's any domestic abuse in a relationship as well, we can help with some of the injunction, the legal side of that. We do a lot of work with immigration and visas,
right?
For people. Debt. I know we're not alone in that. There's quite a few places that will help with debt.
Yeah.
But that's sort of becoming more and more busy.
Welfare benefit appeals. I can imagine that's getting quite busy now.
That is also another very busy one.
Yeah.
So we don't help with the initial applications for benefits, but if somebody's applied for example, PIP, or attendance allowance or particular benefit, or even if they're having problems with universal credit,
right?
And they think that a decision that's been made is not right, we'll help with appealing that decision.
Is that what then leads on to the tribunal? You'll help through the tribunal process?
Help, all the way through the tribunal process.
And is that for free sort of thing, or is that means tested to what service?
That is free.
That's all free?
Yeah, that's all free.
Sorry, let me just pick my jaw up off the floor there. Wow.
Yeah.
And so the Norfolk Community Law Service, is that a multitude of different solicitors giving their time for this project? Is it right to call it a project, or is it?
I'd call it more research. It's been going for nearly 40 years. It's our 40th.
Has it really?
Yeah, it's our 40th year next year.
Did you know that?
We've got a big celebration planned.
Have you?
And it's grown a lot from basically being a few solicitors offering their time for free to then teams of people.
Go on. Now, I was just going to ask a question, but I wanted you to also finish as well, because I didn't want to interrupt.
I won't interfere the flow, because I know I've been really helpful. But just in terms of first point of contact for you and your colleague, is it the 496623 number?
Yeah.
So if we've got any queries as Good Neighbours,
Oh, you're Good Neighbours, are you?
Yes. Yeah. We can
That's the number to call.
Yeah.
That is the number to call, yeah.
Brilliant. Thank you.
That's all right.
Right, so we've got, I think it's now about 40 full-time equivalent staff, about 150 volunteers.
Do you know, I don't think this country would run if it wasn't for the volunteers.
Yeah.
The more I'm hearing, it's like, it's another volunteer.
Yeah.
My question was, before I forget, was, when citizens' advice kind of changed, because I can't remember how many years ago, but legal aid was stopped, wasn't it?
2013, I think that was.
Was it 2013? Did you notice a big impact on the new Norfolk Community Law Service?
Yeah,
The numbers went.
We're still feeling that. Yeah.
Right.
Yeah.
Right.
Because people coming to us, I've got a problem, but I can't get legal aid for it. Yeah, because the legal aid system has shrunk so much.
I don't think that's even there now, is it? Or is it the criteria that?
It's there for very specific cases. You have to be like, it's not just simple as you get means tested benefits. You have to have your income has to be lower than like the threshold for most means tested benefits, and it has to, and it's still in very specific cases that you can actually get.
Really?
So with a lot of family things, unless there is evidenced domestic abuse, i.e. that there's perhaps been police charges, when we know that actually a lot of the time there isn't that. Police say there's not enough evidence, we can't charge. So without that proof, if you're going through a relationship breakdown, you've got disputes over children and things, you can't get legal aid to help with that unless there is that. Yeah. But we'll help with it.
Well, that's good to know. It's good to know that there's somebody there.
Yeah.
Had I known that 12 years ago, no, actually longer than that, I probably would have been on the phone to you.
Yeah.
Well, thank you. All the best. And so what's the big plan for next year's 40th then? Are you...
I'm not sure.
Is it going to be in Norwich, do you think, or is it going to be...
I think we're going to want to do something a bit wider, because we've recently, I joined the organisation a couple of months ago.
Right.
And just
is that why you look so fresh-faced? that's why.
I was at Citizens Advice before that.
Right, okay. Right.
And then sort of came here, and we've also just sort of employed a fundraising officer whose job it is to plan what's happening next year.
Right.
But we want to make
an impact.
Make an impact from that.
Especially if you've been around for 40 years. I mean, I didn't know. Didn't know. But that is quite a list, that, isn't it?
Yes.
Well, thank you, and I hope your afternoon goes all right.
Yeah, thank you.
I don't think
I'll sneak off in a moment and move my car.
Oh, where you parked?
In Lidl, and I was like, I've got 90 minutes in there, and then I'm going to move around to Sainsbury's.
Yeah, that's the downside to North Walsham, really, isn't it?
Yeah.
We need like a free car park, but you can. I suppose you're not a North Walshamer, are you?
No.
Yeah. See, I could tell you one or two little places, but I can't. Not if you're not a North Walshamer, I can't go. Just move over there. Will work.
No, that's fair enough.
Right. Well, thank you.
I mean, I know I could use the paid parking, but I'm a charity. No?
Yeah, and you're here for nothing doing this. Do you know what I mean?
It's I don't mind an extra walk if it means I can park for free.
Yeah. No, I'm with you on that. Right. Thank you.
You're welcome. Nice to meet you.
And you. Trying to think where I'm up to now. I think I've done everything. Alzheimer's. Hello.
Are you right?
I'm all right. How are you? I came round a little. Hang on, let me just get my gimbal down. That's a new toy of mine.
Oh, okay, yeah.
So you are the Alzheimer's
Society, yeah.
So, just trying to think. I know a lot about the Alzheimer's Society and dementia, and I'm thinking, well, from an outside point of view that doesn't know, what service do you provide?
We provide a 3-tier service, which is a general telephone inquiry service about anything and everything. Any questions at all, pieces of information we would send out. Our second tier, we would have complex support, so maybe changes at home, changes in care or looking for care support, changes in any aspect of dementia, because dementia can be quite steady and then something can happen, for example, a urinary tract infection or a fall or admission to hospital, and then it progresses then a bit, so we're there to work one-to-one with people.
It's our dementia advice team, and then we had admiral nurses who were specifically for carers.
Right.
So carers were all carers at a burnout point. Where to turn. They've got complex health needs. Could have totally ignore them because they ain't got time because they're caring for the loved ones. You know what I mean? And then it's a bit of a double whammy when they go down. That affects the person they're caring for.
Absolutely.
So it's just really. We do a lot of what we call pre-assessment before the actual memory assessment itself.
Yeah.
Just to really make people aware we're here. Do you know what I mean? It may be they don't need a great deal. Maybe we've got a memory book or we've got an activity book just to keep people active and engaged because that's so important.
Yeah.
And then after they get a diagnosis, I mean, they've known usually for quite a few years there's a challenge around the memory. But, getting the diagnosis, some people are relieved, some people who have been personally diagnosed are in a bit of denial. Do you know what I mean? Some people are quite shocked and need that time to, come to terms with things. So it's just really show that we are a large organisation, we're a national organisation. We're not working in all parts of the country because our funding relies very much locally. So we've got a contract with North African Suffolk Foundation Trust and the local authority to provide both medical support through the admiral nurse and also our support for 5 years. But that's really
5
unusual.
years.
Yeah.
Is that because of the grant? Have you been given a grant?
Well,
Because I've just heard with that lady, it's for 5 years.
We're a commission service, so we have to tender for it.
I recognise you.
I know you, and I've been trying to work out where I know you from and failed.
Do you have a nursing background? Carers background?
No, not in this area, no. I've been here forever.
What, in North Walsham?
Yeah,
So
I worked for the Society for 15 years. You're not recording this, are you?
Yes, I am recording this.
Yeah.
Well, I definitely.
I don't know whether.
Yeah, well, I've worked with dementia with a few people.
Do you help at the Cameo Cafe?
I have done.
Yes.
Yes. When that first started, I went along to help kind of get it going and was on the committee, and then I stopped a few years ago because things changed, didn't it? Do you know what I mean? But so you're at the Cameo Cafe.
Well, we go and we do carer support.
Yeah.
And,
fab.
I've worked for the Society for 15 years in this area, so I.
That's
kind of been
why.
around, but I literally went to the opening of the Cameo Cafe.
Yeah.
5, 6, 7, no, more than that. About 8 years ago?
Probably.
Because I've been.
Norman Lamb opened it, didn't he?
Did he? Yeah, I wasn't there on that day, but yeah. So, getting back, do doctors refer to you?
Yeah.
I'm talking like I don't
doctors,
know. Okay.
Individuals, self-referral.
Individuals.
Anybody. Yeah.
So, and you've got
memory assessment teams where they do the actual
mental health.
assessment.
So we've got
our.
Let's see if we can find because I want to show telephone numbers and.
To find the telephone number, the 01603 number on the back there.
I've got it. It's that one, isn't it?
556.
Yeah, 556. There's an email.
And there's a portal
as well. An online portal.
Yeah.
The online portal is for professionals.
Okay.
To refer through.
Yeah.
And as long as if you say worried about your neighbour, who you were worried about their memory, so long as they give you consent, you can refer on their behalf.
Yeah. That's the problem, isn't it? If they don't give you consent, where do you go from there?
Well,
But then that's like with anything, isn't it? Do you know what I mean?
Unless there's we say that you can't
there's a
force on
concern.
anything onto anybody's services care, but like Catherine says, if there's a concern, safeguarding concern, whatever, do you know what I mean? Then it goes out of your hands in a way, you don't need that consent. If your life's at risk and they've got a duty of care,
you're concerned about
the local authority.
Say you live next door to somebody and they were going out late at night or something.
Knocking on doors.
Or doing. You could then, I think, override it.
Yeah, I think you could.
Yeah, because a few years ago when I there's an experience that happened a few years ago now, where I was concerned about someone, and it was like I wasn't in the NHS at that point.
Right,
Do you know what I mean?
yeah.
I'd finished and was doing something else, and it's like, how do you access a welfare check on somebody? Because especially if it's somebody you don't know, and you're concerned, because you know they always want to know their name and their address, and it's like, but you can't follow them up. So how do you get a welfare check on someone there and then?
When you find out, will you let me know?
I'm still trying to find out.
Yeah, well, social services, I have a lady, she's 89, got dementia, and her 3 daughters all died of cancer, as did her 2 husbands. Terrible.
And she's the last one left.
So she's got a stepdaughter who lives in Eastbourne.
Right.
And she's got a sort of son-in-law who lives in Scotland.
Yeah.
So nobody's local. And so I referred her to social services, and they went round and said she can dress herself, wash herself and cook for herself, which she can, and keep her house clean. And so there's no role for them because they don't do welfare visits.
Yeah.
So I tried again and said, look, this lady needs some sort of personal assistant, you know, to do things like, you know, manage her mail or what have you. And anyway, so I got a phone call early this week from the assistant practitioner to say I can't get hold of her. There is a suspicion that her telephone batteries may have gone. But have you spoken to her? Which I have not. I'd rung her and it had not gone through. And she said, well, if I don't find out from anybody, I'm going to have to call the police. The Swifts, Norfolk Swifts wouldn't come out.
Why not?
Because they don't do welfare visits either.
Especially a person over that age for GP services.
She could be laid on the
she
floor.
could be.
I arranged for her to have a care alarm with the families, you know, the people, the woman in Eastbourne and the fellow in Scotland with his consent. I had to pay for it over the phone. I literally had to go 2 days on the run. And that isn't really what I'm supposed to be doing.
Yeah.
And the guy said, so I said, will you send somebody to fit it all up? That'd be another £65. He said, all you have to do is take it out of the box and plug it in. Just go the next day and plug it in. And that, it was slightly more complicated than that.
Always is, isn't it? What do you think is going to be a 5-minute job turns out into 3 days.
Have you ever picked up anything electrically? Just plug it in and it works.
When I got there the next day, we got it set up and we got it tested and it was all fine. And then she said, oh, no, I've also got this. And it was a box from Sky TV. I said, that's definitely above my pay grade.
That's it.
Can't do it. I can't work my own Sky, let alone yours.
Yeah.
And, you know, but people need somebody. It's not just about having someone wash. I'm
finding as well with the discharge team at the hospital, they are discharging people into homes too early, and they've not correctly set up any aftercare before doing it. And my old way was you did that before that person got released, and it's not happening. So the stories I'm hearing now. Of course, all for the sake of freeing up the bed.
I have is we work for the Alzheimer's Society, so I always put, this person has got dementia. What they tell you may not be reliable.
True,
And then
true.
you get somebody go round to do the assessment and case closed.
Yeah. Well, because they said everything was fine. Yes.
And you've got
I've seen that.
Out because they haven't been contacted or son or whatever.
Yeah. But then you've got the danger, haven't you? With somebody like that, you then possibly got to think, have I got to go down the section route with the doctors because this person... And then it's a case, but if the person's saying, I'm all right, Jack... There's still a lot more to be done there, isn't there?
And his doctor actually rung the family up, and his son cares for dad with dementia for a dementia review, right, or a medical review.
Yeah.
So they didn't get a reply. Son rung back, and doctor went, "Oh, what are you ringing me for?" He said, "Well, you rung me." However, what we do need to get a dementia review. What we do need to get in place is, have you done your DNA?
Yeah.
Have you got all that stuff out?
Yeah.
And he says, yes, we have. But he says, if I'd have been totally not done that and you'd have just come out and said, well, we need to sort that first, it's just gone to pieces.
Yeah.
Do you know what I mean?
Yeah, there's a time and a place when to bring that in.
Yeah, there is.
Do you know what I mean? That is very... I mean, it's very helpful because of a lot of the carers out there and agencies. You need to have that backup.
Yeah.
But you don't come straight out with it when you first meet someone. Do you know what I mean?
We've heard so often about surgery in this area. doing what they call a dementia review. And it's like, well, what is it? What are they doing? They're usually ringing the person with dementia and saying,
how are you?
Right, are you all right today?
Yeah.
And they'll say yes.
Yeah.
There you go. There's
Yeah,
a tick
no,
box there.
You're aware of the politicians of government now wanting to do this NHS consultant?
Oh, yeah.
Have you done that yet? Are you?
No, we haven't seen anything.
You haven't?
No, I haven't.
Is this about sharing data?
No, it's to do about
community sort of hubs where you'd have a GP surgery next to somewhere where they do the care, they provide the care providers. And is that what you mean?
No, this is to do with Keir Steps. I can never say his name, Stammer, whatever it is.
Yeah.
That they're doing a consultation on the NHS. There's a website that's been given out.
On the news.
Yeah, and that you click on it and you can do. And it's like, hang on, the last 10, 12 years, people have been writing about it. It's on all social media, and it's like, you know what?
Where's it
What was
all
it? 15 years ago, they did a £10 million consultation on the country of how many people were depressed, and that cost 10 million. And it's like, come on!
It's not about throwing money at it, is it?
It's about tying all the loose ends so we can all communicate with one another.
I think they're working from a model when the NHS came in. Whenever it was
didn't
50s.
that work?
Well, it did then, but it's completely different now, isn't it?
I think it is because of science, because of different departments.
A lot of the demand is, a lot of it's mental health, and I don't think they're equipped for it. I think they just send out your ambulance or whatever.
The problem is, from me, coming from that background, is when I worked with learning disability and in learning disability hospitals, that was the first cut. They wanted to sell all the hospitals. They did. And that's when Care in the Community came out. You know, and then they sold the police stations and the schools and school fields and the forests and fire stations, you know what I mean? And then after the learning disabilities, I had then kind of moved over to the mental health sector.
Did you work at the Sophie Centre or at the Julian Hospital?
I have been at the Julian Hospital. I've also been Claire Smith. I would have been Claire Smith then. Yeah.
Because I used to go quite often and do a little carers group for the inpatients.
Okay.
I might have seen you there as well.
You might have. I didn't have the tattoo, and my hair was probably slightly longer.
So what is your surname now?
Smith Hawkins. Yeah. Right.
So who did you used to work with? I mean,
I was within the NHS, and I did my training.
When you were with the mental health team?
When I was with the mental health team, at that point, I was then a student, especially at the Julian Hospital. That would have been then, because I did it's for the elderly.
I used to sit for a couple of years in the MDT meetings with, I'm trying to think of the woman's name, who ran Linda. She was the forerunner to Dominic Everett. Do you know Dominic Everett?
That name ring a bell?
Yeah, he's the clinical team leader now.
Yeah.
Been so for some time. And I can't remember Linda's surname. But so, did you know Sophie Gibbons? Why, the Sophie? No, because it's called the Sophie Centre. Sophie Gibbons was a community mental health nurse, died of pancreatic cancer, which is why it was renamed Sophie Centre.
Oh, bless. How long ago did she die?
6 or 7 years, actually.
Oh, right, yeah, that was after. That would have been after that. But I went, one of my bits that I did was on the crisis team, and that was fantastic. And when I qualified, it's like, that's the place I want to go. And it was a case of even that got hit, do you know what I mean, with funding and everything else. So that's because where is the crisis team? The areas were getting bigger and bigger and bigger. And have you heard of Narcon? Have you heard of? And it's to do with mental health. They're these new
think I might have seen it
No,
somewhere.
no. Oh, no, Connie on. No, Cannon. Oh, I can't. That's because I've heard that over the last kind of few years, but I've also heard of a few deaths, and it's like
A few what deaths?
yeah, in the clinics where it didn't happen. I mean, if somebody is depressed and want to commit suicide, 9 times out of 10 they'll go to Helston or somewhere, because there's always been this thing that, you know, they don't want to do it in their family home, or they don't want their family to find them. Do you know what I mean? So it's always quite high in hospitals anyway. But within this, I think because of their lack of medication that they believe in, it's like that's a slight issue for me. I don't want to see people who are medicated, but I do believe that some medication is the key.
Hello, when I hadn't been there very long, and it would have been when Care in the Community came in, the mental health nurses used to have a list of regular patients who they would go to do their depot and you know, their lithium test or whatever they had. And they said, we can keep them ticking over. But now what you do, you know, you do a piece of work and then they're closed, and then, you know, they hit crisis and we get them back. And it's a complete roller coaster. Whereas if we could keep them just on our books, you know, and just do their depot or whatever is involved, it'd be a lot easier, but that's not how they work.
No, because it was too easy, wasn't it? That was the problem. It was too easy, but it worked.
And we're the same. We you know, we used to support people from start to finish.
Yeah, we did.
And
literally do everything, didn't we?
But now it's about outcomes. You know, what am I doing for this person?
Box ticks.
Yeah, because there's so many. That's the trouble, isn't it? We couldn't keep everybody on our books. Otherwise, like the mental health team, we'd be overwhelmed.
Yeah, but then put the money in so we've got more mental health nurses. Put the money in where we've got more mental health
people still
learning
get that
nurses. And
reassurance of having a worker that they know they've talked to for several months.
Yeah, well, it's that consistency as well, isn't it?
You don't want to go through your whole story again.
No. Especially with something like this, it's the last thing you want to do.
Yesterday, her mum's got dementia. She's been living with her daughter and her husband for a long time, and she went sent her to hospital with a chest infection and shingles. Really poorly lady. She's 89. Not sure whether she's going to come out or not. And you know, I just talked to her for nearly an hour on the phone.
Yeah.
You know, and I didn't feel there was anything I could do or had done. She said it's just so nice to talk to somebody who understands.
Our carers at Cameo in North Walsham, they get so much out of that. Even just being in a room where they know they're not on their own.
Yeah.
You know, they know that the guy opposite them is caring for his wife, etc., etc.
Yeah.
This lady I spoke to her this morning. And she was going to the Norfolk and Norwich every day, and it was a long way from here to the Norfolk and Norwich.
Yeah, probably about a good 45, 50 minutes on a good day. On a good day.
And after roads are going to be shut at whatever time. Anyway, I said,
parking.
You know, you don't need to go every day. Use this time to recharge your batteries.
Yeah.
You know, I think I probably just said what she wanted to hear, really. But, you know,
but sometimes that's all it takes.
She was feeling guilty for not going.
Yeah.
I said, look, she's being well looked after. And she is, to be honest. She was very happy with the care that her mum was getting. And they were giving her the information, which is always good. So just give yourself a couple of days off. Go every other day.
Yeah, absolutely. Absolutely. Well, thank you for the chat. And you go to Cameo Caf quite a lot?
Yeah, we do. We're there at least once a month, I'd say.
Oh, yeah.
On the off chance,
Well, if I ever pop in when I see you, I'll say hello.
Yeah, definitely.
And remember me. I don't think I'm difficult to forget, but thank you. Thanks for your time. And that is that. Nobody is using the tables, but they're there to be used. And I think we can wrap that up. There we go. Shame they want a better turnout. Yeah. Hope you've enjoyed it, and I want to say cheerio now. So cheerio.